Well, it is a pleasure and thank you once again for joining us on Beyond the Surface. This is where we discuss critical and pertinent, significant issues that affect humanity. And this time round, we'll be digesting matters of issues that do disrupt normal function of young people. We know for a child to attain a full developmental milestone, they go through a number of things. But one of those disorders that disrupt their day-to-day functioning is a disorder called autism. Tonight, we take time to digest matters of autism. What is the cause? Do children with autism grow up like any other children? What is my role and responsibility as a parent who has a child that has been affected by autism anyway? What are the misconceptions underlining this neurodevelopmental disorder called autism? Racheal Nakato is a clinical psychologist under training from Makerere University, brings us closer to this discussion. Racheal, thank you very much for joining us on this episode.
Thank you very much for having me on this show. Uh, Racheal Nakato is my name, and I am a clinical psychologist trainee in Makerere University.
First and foremost, help me understand when we talk about autism as a disorder in children, what exactly are we meaning?
Autism is called autism spectrum disorder, and it is a neurodevelopmental disorder that affects the brain. So, children are vulnerable to having autism while they're growing up or even before. So, autism is characterized by core symptoms of social interaction and communication patterns, repetitive behaviors, and sensory processes. So, when a child is growing, we understand that there are certain developmental milestones they're supposed to achieve, and which is not normally the case for autism. So, that is why we call it a neurodevelopmental disorder. So it is within, we actually we don't it is not, we don't know the known cause. So it is within the brain. So it is in the brain abnormality structure. So there is a problem within the brain structure. And that is why we see these children having autism and not following or not achieving the developmental milestones as the normal children are supposed to.
Yes, I understand you've broken a bit the causes of autism, but in details to a parent, to anybody listening to us and viewing us. Rachel, bring me to closer on some of the causes that bring autism as a disorder to the children.
Yeah, well, thank you very much. Autism is not really, with research, according to research, autism does not really have a known cause, but we know that it could be a genetical. Yeah, it could be through genetics, it could be environmental, whereby a child is within the environment, it could be through toxins when a mother is pregnant. So, one of the main causes of autism is that we look at the genetics mostly, generation from generation to generation. So autism is really not, we don't have a specific known cause for it, but we emphasize on the genetics, the environmental factors that could be within the child.
Like any other disease or call it disorder, there are usually misconceptions that underlines every disorder. When it comes to autism as a disorder, bring me close on some of the misconceptions that are attached to autism as a spectrum disorder.
The misconception. Thank you very much. Now, when we talk about the misconceptions or a myth, yeah, most people or most of the parents that are having these children may not exactly know what is the issue. We very well know, like I said earlier, that autism, or when a child is growing up, there are those developmental milestones a child is supposed to achieve. But in the case of autism, children with autism actually have what we call poor eye contact. They cannot face you directly, they cannot speak, they cannot communicate. That's why we said repetitive pattern of behavior. You know, when you can, there's what we call echolalia. When you tell a child, maybe, do you want this toy? The child will say, toy, toy, toy. Why? That is how they perceive it. So when we talk about the myths that you had asked earlier, the misconception is that most of the parents don't know the symptoms, and they end up not even understanding what is wrong with the child. A child is supposed to speak at least by 1 year. Child is supposed to crawl. Child is supposed to stand on things. But in the case of autism, children don't talk. They are silent. They don't know how to communicate effectively. They don't do that. They don't do these things that other normal children do. So the first myth is that they think it is, yeah, my child will grow up. Eventually they will outgrow and they will speak. Yeah, but these are some of the things that the parent should know. By 3 years, the child must have attained the achievements. But autistic babies by 3 or 4, some are not talking. By 5, they are not communicating. So they have this thing of, yeah, the child will outgrow. It's okay. It is something a child is going to outgrow. And then the other thing is they don't know how to even understand their children. Some parents actually don't understand their children so well. A child is growing up, but as a parent, I expect you to know that there is a problem. Yeah, when a child is growing from 1 year, 2 years, 3 years, you could see right from down that there is really a big issue. So some are like, no. And also culture sensitivity. Some cultures are like, yeah, children don't grow, children will grow. And then there are those moments, maybe the father side they are quiet, maybe the mother side they are quiet, but eventually by the time they get to know, it is too late. It is really too late.
Rachel, bring us to speed on the diagnosis of autism. I understand all the disorders have their own diagnosis. If it is attachment disorder, the diagnosis is different. If it is IDD, the diagnosis is different. If it is anxiety, the diagnosis is different. If it is suicide, the diagnosis is different. When it comes to autism as a spectrum disorder, bring us to speed on its diagnosis.
Well, again, thank you very much for the question of diagnosis. We very well know that I'll just actually make a clarity. Autism is worldwide. It is not only in Uganda. It's also in the different parts of the world. And with diagnosis, when we look at America and Europe and other countries, children are diagnosed before 36 months, and that is now 3 years. But here in our country, in Uganda, just like we say, we talked about the myths and people and parents not understanding their children. We tend to see that children are diagnosed a little bit late. There is a delay in the diagnosis. So a parent may be told your child has autism at 5 years. But because they did not know, they are not aware what happens, they are not aware of the causes, they are not aware of the symptoms. So there are certain things that are missed while the child is growing up. So the diagnosis here is a bit delayed, not because we don't have what it takes, but it's because some parents do not understand the symptoms and the causes of the spectrum.
So, what are some of the areas where a child with autism is affected?
Well, the brain. So we normally consider the abnormalities that are in the brain. You get my point. That is why I said earlier it's a neurodevelopmental disorder. We can also talk about the cerebral palsy. Those are all neurodevelopmental issues. So a child who is autistic actually will not think like a normal child. They're always vulnerable in communities. They are beaten up simply because they don't know how to communicate. We have what we call the patterns, the repetitive patterns of behavior. You can find a child having a leaf, yeah, and then they're holding this leaf in just one end from morning to evening in a particular place. They don't associate. That's why we say their social interactions are not there. They're always by themselves. They're always cocooned in one corner. So you find that there are certain things that they don't understand. So it is within the brain that now there are certain abnormalities that occurred in the brain. And that's why when we're also assessing parents, we always normally tend to ask, how was it like for you during labor? What was wrong with the child? Did the child cry in the first place? How long did it take the child to cry? Was the child taken to the nursery? Did the child turn yellow? All those questions are very important for us to rule out certain things.
And maybe when do I conclude and rule out the fact that this child is autistic in nature?
Well, thank you. A child who has attained the developmental milestones and achieved them properly, the normal way, will be very sensitive to even telling them, bring this, and they will immediately accept, or they will immediately do it immediately. For example, when a child is growing up, we know that they will crawl, they would cry when they're hungry. You would tell that the child is really hungry. Even when they cannot speak to you directly, they would show signs. But an autistic child will just be there. They are not cry babies. They don't cry. They will not cry like a normal child crying. So even when they're doing their own things, that is why I said parents need to be particular and very keen when the child is growing up, so that they can rule out, why is my child not talking? Why is it at that 3 years or 4 years my child is not talking? So that is when now concerns are coming up and parents are getting worried that the children are not talking.
You keep reminding us of the past, especially when you are dealing with matters of autism. So why are you interested in the past, especially when you are talking about children, you're talking about parents, what they went through? Why are you interested in the past when you are diagnosing autism?
The reason is that there are so many things that happen when the child is born. Even when the mother actually, before they get into labor, there are so many things. The mother could get into a prolonged labor. The mother might have not even gone for pre-antenatal, and then the child is affected. So whatever happens to the child within the womb is very, very important. That is why we ask them, what was it like for you when in labor? Did you push? Was it a C-section? How was it like? Did the baby cry? So those are some of the things that we can now start off when we are diagnosing with some of the neurodevelopmental disorders in children. Yeah, I will ask you. So, when the child was born, did the child cry immediately? When they were taken to the nursery, how was the weight? How was the heart? I mean, the pressures are also seen. So, in case there is something and the doctors have detected something, these children are normally taken into the incubators, the prematures, and those. So, those are some of the things that we look at when we want to diagnose.
And maybe I would like to know, what is Uganda's perspective when it comes to matters of autism, Rachel?
Uganda actually now autism is on the rise. Yeah, in Uganda, autism is now on the rise. And earlier, we didn't know, like I said, the misconceptions, the delayed diagnosis, yes, could be there. But now people are now getting aware, We are trying to do awareness creation. That is why we are doing the clinical psychology. We want to create awareness. We want to let people know that in Uganda, autism is now on the rise. Yeah, autism is now on the rise, and each time children are assessed, we are seeing that there are so many, autistic babies coming up. So I'm very optimistic, and I very well know that even the statistics right now, it's high, like 0.8% right now, and a child out of maybe like 10,000, maybe 0.8% of children are diagnosed on the spectrum disorder.
Is there any place in Uganda, Rachel, where children with autism are treated, or if somebody out there who is viewing us maybe has an autistic child, would want to know which person is responsible to help them? Which place can I refer such children for help? By and large, are there places and which people are specifically qualified to help and deal with children who are autistic in nature?
Yes, thank you very much. In Uganda, we have certain centers. We have what we call Nachivubo Blue. It's attached to KCCA in Central Division, where children are normally taken for speech therapy, occupational therapy. And then we also have a place called Autism Donor Center. That is also another center where these children are taken, where these children are looked after. Because remember, they cannot be in society like other. Like I said earlier, they're vulnerable. They can be beaten, they can cause harm. Remember, because they cannot communicate effectively like a normal child. So we have such centers. We have Uganda Autistic National Center. You can take them to any of the places. Yeah, you can take them to, and also Butabika National Mental Referral Hospital, a mental facility that can also take care of children who are autistic.
Unless there's anything else left, Rachel, you have the opportunity to make your recommendation on this subject matter of autism as a disorder that disrupts the day-to-day functioning of children. as we plan to wind up this conversation?
Yeah, the recommendations actually are many. To begin with, parents should ensure that they really, really understand these children while they are growing up. They should pay attention to that children growing up. They should understand the developmental milestones. Are they delayed? Are they achieved the appropriate way or the normal way? Yeah. They should also know that when they see something, they should be very keen at these children growing up. When they see something that is really not clear, they should also seek medical attention. Take a child to the mental facility. Ask what is wrong. My child is doing this. So that is number one. Ensuring that there is proper safety, ensuring that the children are really looked after carefully, but also understanding the developmental, achievement, their milestones is very, very important for us to understand that a child has been diagnosed with any kind of neurodevelopmental disorder.
And maybe just to be very clear on this, is there really medicine to cure this disorder called autism, or there is no any medication for it?
Well, autism is not curable, I'll say, because I didn't actually clarify something. There's something I'll just talk about slightly, that as a spectrum disorder, autism has a wide range of developmental disabilities with variations in symptoms. So these symptoms could be mild or severe as a child keeps growing. So what we normally do is that, first of all, autism has no medication. Secondly, autism is a lifetime challenge to so many, parents and also children having it. But what we normally do is there are certain interventions, yeah. We could have comprehensive interventions where a child could be taken to an inclusive school, a school that is having children that are autistic, a school that will understand how this child is supposed to be handled. Much as there is no medication, we have other occupational therapy things they can do. They can go for speech. They can be given actually handwork, craft work. These children actually can turn out to be the best versions of themselves. Even when they don't have that kind of medication, these children can be catered, but they can be helped to understand. Yes, even when they cannot talk, we can get a speech therapist. We can take them to inclusive schools where they can be monitored and managed.
Your parting shot, finally, as we close this interview.
Again, I thank you very much for this opportunity, and I would want to talk to the parents out there, whoever is viewing us and whoever is listening in. Autism is very, very a disorder that is now on the rise in Uganda, and the parents should really be very careful, even when there is a problem, like I said earlier, even when you find something that is not normal with the child. That's why we say they are neurodevelopmental, because it is within the brain. So much as we don't know what happens within the brain of the child, their brains are so small and they're still evolving. What we need to understand is that we need to really, really take good care of them and understand why does my child have a floppy neck? Why does my child be on one end? So those are some of the challenges that parents have. And I just want to urge everybody there to really be very cautious when these children are growing up. While we keep, doing our clinical psychology work and intervening with parents that are having children on not autism alone and other also different neurodevelopmental disorders, it is very heartfelt and warming for me to talk about autism, and I'm very happy and glad that I have at least said something about autism.
Thank you very much, Nakato Racheal, a clinical psychologist from Makerere University, bringing us to speed on autism as a disorder that disrupts the day-to-day functioning of young people. And if I am to quote her verbatim, autism affects the cognitive, it affects the social interaction, and it affects the communication of young people. It is our obligation to make sure that we observe our children as they transition from one stage of life to the other. Thank you for being part of this episode of Beyond the Surface. My name is Fred Makuya.